Good morning, I'm Jessica Lovell. Today we bring you an encore presentation of one of our very favorite programs. We'll still be live with you this summer, Monday, Wednesdays, and Fridays, and then come September, we'll be back with our regularly scheduled programming. Until then, enjoy this encore presentation and make it a great day.
And welcome back to Open Mics with Dr. Stites. A lot of people are saying the pandemic is over, but we have numbers here at the health system to share with you a story that might say it just a little differently. Today we're going to look at 3 years of the pandemic, where we were, where we are today, where we're headed. Joining us here in the Dolph Simons broadcast studio are a couple of good friends who have been with us throughout the pandemic and been on this program multiple times over the last few years. Dr. Lee Norman is currently the Senior Medical Director of Optum and previously served in multiple capacities. He was the KU Health System Chief Medical Officer. He had that job before I did. We both were commenting, that's a hard job. He then was KDHE Secretary. I think that was a harder job. And then he was the State Surgeon of Kansas. He's also a retired colonel from the Kansas Army National Guard and serves on the Defense Health Board advising the U.S. Secretary of Defense on health matters. We are also really pleased to have back Dr. Catherine Satterwhite, who is the Regional Health Administrator for Region 7 of the U.S. Department of Health and Human Services. She's been on this program multiple times before. We've had a lot of great discussions about policy and everything related to COVID and a lot of other stuff. So welcome to you both. I know our viewers will have some great questions for our guests. Send those in to us now on YouTube, Facebook, Twitter, and the Medical News Network. You'll find those links right here on your screen. Jessica Lovell will join us in a while to help us answer those questions. It's been almost 3 years to the day that we aired our first morning media update. Back then we called it the morning medical update. On Monday, March the 23rd of 2020. Dr. Norman, when he was KDHE Secretary, was on that first program, along with U.S. Senator Jerry Moran from Kansas. Here are some of the insightful things Dr. Norman shared with us on that day, and on many more after that. And by the way, you're going to get a grade at the end of this. We're going to see how accurate you were. I don't know how you're going to do. We'll find out. All right.
This is a unique situation, the likes of which I've never seen before. I think we're going to see continued growth for the next few weeks. It wouldn't surprise me if we were at 300 to 400 patients even the first part of April. There are people that want to find a rule and then find a clever way to skirt around the rule just because they can. That's the wrong idea. That's the wrong attitude. I think that the fact that Governor Kelly did the early school closures and the early stay-at-home orders bent the curve more than anything else.
And when you look around the state of Kansas, and I know this is true in Missouri and others that have a lot of rural and even frontier areas, people say this is not a risk to us, so don't tell us to wear a mask because the treatment is worse than the cure. Removing for example, the phased-in plan that the governor put out, occurred on May 26th. That's when most of the counties kind of took away any kind of mandate and had it be guidance, and that's when we lost control of the state.
I think it's a great time to take a pause. If we screw up during Thanksgiving and have a huge surge of cases, December is going to be bleak. So I would recommend that people virtually carve the turkey with those they love.
Virtually carve the turkey with those they love. That's a good one. Actually, I think you get an A grade on most of that stuff right there, Norman. I'm just going to say it to you. So, Dr. Norman, you have always been able to tell it like it is. None of what we like to call flapjacking, flap your arms, jacking with the truth. That was pretty darn important. But talk to us, how important was it in the early days of the pandemic?
Well, we knew so little at the beginning of the pandemic.
Build the airplane while you fly.
Yeah, we didn't know where it was going to go. You know, I just come back from the Middle East and had seen the prior and still existing novel coronavirus with a 32% case mortality rate. The SARS that we both remember, all three of us, 9.2% case fatality rate. And the fact that COVID-19 came in with a mere 1.2 case fatality rate and 1.25 million Americans dead from it, the largest mass casualty event in the history of the United States, I think we really dodged a bullet, but I can tell you we didn't know that in the early days.
We did. Well, we saw the pictures coming out of Italy and New York City when things were clearly overwhelmed and there were no precautions in place, and we didn't know what the heck we were doing for therapy. We were trying ivermectin way back then.
Yeah. I mean, we actually, early days, we called to France and to Italy and other places that were seeing more of a surge of cases and we asked them, this is not high science, this would be low science, does ivermectin work? Does azithromycin work? Does hydroxychloroquine work? Because we didn't have any money to buy it, to spend on it, but it was selling at the top of the market. We were going to try to find some if it worked, and everybody that we talked to that was a few months ahead of us said, no, don't do it. And we didn't do it, and it was the right thing to do.
Yeah. So it's been 3 years since COVID lockdowns and stay-at-home orders. There's been a lot of resistance at the beginning. Talk to us about the level of resistance, and also what did we learn? We were talking a little bit about that beginning of the program.
Yeah, I think that if there was any miscalculation, it was a couple things that in retrospect, of course, in retrospect it's easy to find things, but one, I thought that science would prevail. I really thought that people would listen to experts and listen to science. Quite honestly, the Trump administration, I think, undermined the credibility of our experts, and I think it just percolated out and caused a terrific amount of divisiveness in the public, and it was hard to recover after that. The second thing is we always tried to provide the best information, but I personally would say this is what we have today. Stay tuned. Tomorrow might be something different. And I think in retrospect, people then would weaponize those earlier comments and saying, geez, you don't even know anything about it. Yesterday you're telling us this, and today you're telling us that. But that's what happens as things unfold in a mass casualty infectious disease emergency. So,
and I love the way you describe that. I mean, it's sad to describe it, but it was a mass casualty with 1.25 million people dead. Yeah. And I think, to your point, and we said this in the program, so we are building the airplane while we fly it, and sometimes the parts don't fit. But we don't know that when we're trying to get them to fit. We're just doing our best to advise people with the information that we had. People mistook that for lying. That's not lying. That's trying to use your best guess. But you know what? I think we were right a lot of the time. You know, when we would see those surges rise, like you said, carve the turkey virtually in November, because we knew then in that late November, December, January, those were tough months, and the following year they even were worse. And that's when we had all this, the Chamber of Commerce and all the people around coming together and saying, guys, we got to put masks back on because we know that masking works, and yet there is still all that resistance out there, but we're just trying to keep each other safe. Dr. Satterwhite, what was the HHS role in the early stages of the pandemic?
HHS played, a number of different roles. From my perspective, when we think about how we were responding as a nation, one of the roles that I played in Region 7 was to coordinate with FEMA, the Federal Emergency Management Agency. You know, that's our hard hitters. They really know how to respond to emergencies, and this was also totally new. So we also coordinated with ASPR, the Administration for Strategic Response. But most importantly, I think one of my roles was to actually talk to people like Dr. Norman. What we were trying to do was coordinate information at multiple levels and trying to be as transparent as possible, but recognizing there were so many moving pieces and so much new that was happening literally minute by minute. It wasn't something, so when Dr. Norman mentioned that he would try to communicate as clearly as possible and say, we'll know more the next day, it was to the point where we might know a lot more in the next hour. And that's very difficult. So HHS really tried to work with our front line, whether that be our doctors, like those working here, our nurses, our local public health departments, our state public health departments, but importantly, really trying to coordinate across our federal agencies as well.
Yeah, that was a big deal. So what were you think the biggest challenges you faced in that?
I would actually, it's information. I think the biggest challenge was trying to figure out how we could communicate science in a way that was understandable and that people could hear, respect, and process. And I think we struggled with it for 3 years. We still struggle with it.
We still do. And I'm with you. I think the distrust of science that came out as a result of political leaders undermining it, as opposed to saying, look, here's what we don't know, here's what we do know, and there's a gap between those two areas. And right now, what we don't know is a lot bigger than what we do know. And instead of saying that gap is why science exists, we try to take what we don't know and turn it into what we do know. What they did is saying science is inadequate because you don't know. And that wasn't the challenge. That's how learning in science works, Lee.
Yeah, it was changing every day, and it was used against us so often that we're hearing inconsistent messages. Even the experts don't know, and that was tough to live with because and I remember one of the highlights of my career will forever be the press conferences I did with Governor Kelly, and the reason was we were of like mind and would put the information out there and say, here's what we know today, here's what we'll have to get back to you about, and we will get you and give you what we know. And the toughest part was to have that used against us eventually. And I understand that there's, political and other ideations, particularly about immunizations, for example. But we just tried to put the team together and hold the team together in the state of Kansas and move ahead. Dr. Satterwhite and her people helped us to navigate those multiple jurisdictions, everything from federal, state, county levels. And we had overlaps, we had underlaps. And it was really critical to pull the resources together. It was a lot about assembling a team.
Yeah, I think that's a big deal. And I remember the data, too, just around masking. Masking was such a hot controversy. And, we've relaxed masking here as things have improved here in our hospital here in the last few weeks. But, we remember the data that looked at counties that had a mask and counties that didn't. And that the counties that had masking had a markedly lower infection rate, more than 50% decrease. So, the data around masking is overwhelming. We've known in health and in public health for generations. It's not new. But, man, people rebelled against that. Tell me about that. What do you think that rebellion was?
So I think people were in a place, so going back to a little bit, so I think people were in a place where they wanted black and white answers. They really wanted clarity. And science and experts weren't able to give them clarity in some ways, but that's because we haven't. So I was just thinking about this while you were talking. One of the things that we teach our elementary students to, our high school students to do, is embrace this idea of a growth mindset, and that's idea of yet. Like, we are all on a path of learning, and science is too. So masking, I think we struggled with some of the communication around masking early, and that really hurt us because I think we tried to make it a little bit more black and white when it really needed to be a little bit more like we're figuring this out right now. So I'm not sure. I think masking is tricky. The science is really clear. It is a barrier method.
It works.
It works. But people I think we're struggling in so many ways that felt like something that, just a lot of people they just know. That's where I'm drawing the line.
We don't know. It's a big, massive information, and we don't know it yet. Here's what we do know. To get from what you don't know to what you do know, you got to figure it out, and that's what science does. It takes things you don't know and turns it into what you do know, but that takes time. And at a time with a mass casualty event, things changing really fast, you had to give your best educated information that you could while the science got caught up to what you needed to know. And that just takes time.
The other key piece, I think, to this too, when we're talking about information, and I know that Dr. Norman and I have talked a lot about this, as well as you, Dr. Stites, is this idea of compassion and listening. I think we underappreciated at the beginning where people were with their mental health. And what the impacts were. So we were thinking very physical science, and we may have missed an opportunity early in the pandemic to really take a step back and listen and hear and try to have that individual attention to people to help them where they were.
Yeah, it was hard. So let's talk a little bit about that. So first of all, tough choices around resources. You had to make some of those decisions with HHS. Talk to us a little bit about that.
Yes, I mean, I think the biggest and toughest decisions were around how we had to allocate a limited supply of our early therapeutics and vaccines. So we had to make that decision at the federal level, and we had to do that with the data we had and trying to make equitable decisions. And then we further had to, give this reduced supply to our states, who had to make the exact same decisions we had. And we were trying to figure it out as we were going. Equitable distribution was always really important, but it's hard. And different parts of the country also have different populations, make different decisions. So at a federal level, that's difficult. And then it looks very different on a state level. So if you're in Kansas and Missouri's doing something different, you have that sort of pressure as well.
It's a big darn deal. So, Dr. Norman, you brought a graphic that shows very clearly the effect of those early public policy decisions and intervention. Let's take a look.
Yeah, what you see there is a timeline. On the left of that is March of the first year, 2020, and at the far right is end of June of 2020. And you see that upslope is the number of cases. The two green arrows are when Governor Kelly put in the school closure. The next one was essentially a stay-at-home order. Cases continued to rise for a while, but as we thought we would, as people contained their travel and less mass gatherings peaked out. And then on the downhill side of that curve was the Ad Astra plan, where there was a gradual reopening to allow more gathering and the like. At the beginning of that red bar there, that's when the legislature intervened, did some things to erode away at executive authorities of the governor, and put curtailments in the kinds of public health guidelines that could be put in place and mandated. And as I predicted, you heard at the top of the hour, as soon as you relax those things, the case is going to go up, and up. And that's exactly what you see here. That dip in that graph there, I think, are the lives that we saved in the cases we prevented.
Yeah.
Now,
and I think each time we masked, we saved a lot of lives, and not just from COVID, but from heart attacks, strokes, sepsis, and all those other things, because you couldn't get in the hospital. I mean, there was a time in January of 2020, you could not get in the hospital easily. And we saw the data from the Mission Control Lab of how many patients were dying in rural emergency rooms because they couldn't get transferred to higher levels of care.
and you think about it, to go from 2019, where there were 0 COVID deaths, to being the 3rd leading cause of death for the next 2 years, that's pretty dramatic.
Yeah,
in the state of Kansas.
Dramatic. Yeah, well, and across the country.
Yeah.
Right? I mean, it wasn't just limited to Kansas. So, why was Kansas one of the early states to invoke school closures and to dissuade mass gatherings? Well, how did you guys come to that?
You mean other than great leadership? It was a governor who...
I need some anti-nausea.
It was a governor who was very willing to listen to guidance. She also spanned across the country to look at best practices, and even early returns were coming in that was a policy decision and that was made sense. And I give her a lot of credit for taking it, because that was a bold measure.
You know, it was a bold move, and we know, and I want to get back to your point about mental health, because it's clear that staying at home, not being in school, created a lot of challenges in mental health. As you look back at it, would you make the same choice?
Yes, because I would have had the same information
at the time
to make that choice. There are a few things that maybe we could have done different, but that would not have been one of them.
Yeah, and so now, armed with this new information, if another pandemic, same circumstances, what would you do differently? And knowing that what we do know, would either of you do anything differently?
So thinking about that decision, so I think from a scientific perspective and from a public health perspective, we err on the side of caution. And we err on the side of caution until we get more information. So I would have probably erred on the side of caution, much like Dr. Norman did. You know, at that time, we didn't really know what COVID-19 the impact was going to be on kids, especially. And I think, you know, we were remarkably lucky that the impact was not greater. Even having said that, we do know that COVID-19 has impacted children to a great degree. So, you know, I think it's still a best practice in public health to err on the side of caution and adjust as we learn more. So from that perspective, I don't think I would have done anything different there either. Mental health perspective, I do think there is something to be said about how we think about our communication and understanding what people are sacrificing in order to keep our population physically safe. And we got better at that throughout the pandemic, and I think we will be better at it in the future. But we may have missed a little bit, but we're learning, and I think that's what we have to do all the time in science.
Yeah. If you armed with all the information you have today, if you were focused back there, would you have changed any of those decisions?
I don't think I would have changed the public health guidance that we gave the governor. I do think that from a crisis communication standpoint, perhaps we could have done a little better. And let me give you one, because words matter. And one example is, and as much as I really appreciated General Gustav Pernon, and who was Trump's Operation Warp Speed leader, four-star general that led the rollout that Catherine talked about of the vaccine, the mere use of the word warp speed, I think, was a little bit derailed the confidence, because people thought, oh, too fast. And I think ultimately, when you look back at what happened later in that year of 2020, when people started seeing a lot of vaccine reluctance, I think people said it just isn't ready for prime time. And yet that research had been going on for 15 years.
Yeah, it was not new research at all, and it was a hard time communicating. The thing that I dislike the most about the whole pandemic, it's one thing to fight a disease, it's another thing to fight a big political battle in the midst of the disease. Normally what I found is that when people are in something like that together, they tend to rally together. And instead, it felt like we rallied apart. And I still don't, there was a mass psychology there that I don't understand. But Catherine, you're smarter than I am. So,
I think, and I'm just kind of spitballing here.
Yes.
But I think in times of crisis, people gravitate towards things they know, and the people they're comfortable with. So I wonder how much of that goes into play. When we're thinking about, again, following back to what do I know? What do I feel safe with? And who do I trust? That trusted messenger thing can't be really underestimated either. Going to crisis communication, we need to remember that trusted messengers look different, are in different places, serve different roles, and that we aren't always the trusted messengers that people will look to. So we have to engage our community and engage other people who we work with, who we know, to reach the community better. And I think maybe that would have helped a little bit better to do early on.
yeah, there's a lot of truth in that. Okay, so what do you think are some of the biggest things that blocked people from getting vaccinated? Dr. Norman mentioned a few other thoughts.
I actually think that distrust in the safety of the vaccine is probably the number one thing.
So I saw just to say, guys, there have now been 13 billion doses of vaccine given across the world. It is safer than just anything you could do. I mean, it's probably safer than drinking water in some areas.
Well,
it's really
and
impressive.
I think we've said on this show how many times that this is they are looking at this vaccine inside out. It is going to be monitored and monitored for years and years. And I think it's being more heavily monitored than any vaccine ever. Yes, it is safe. It works.
Yeah, it is safe. Now, you've also been doing a lot of work around long COVID. What are you finding?
Long COVID is something that I think it's going to be with us for a while, and we are continuing to try to really understand what that is. For anyone who's had symptoms that are aligned with long COVID, it's tricky. It looks like a lot of different things. The federal government is really committed through the Biden administration to prioritizing long COVID, because we know that it's not a one and done either, that a lot of people will recover, but a lot of people, the recovery looks longer, and sometimes we don't know if they will ever fully recover, which does, just for a little plug, mean that it's still important to be up to date on your vaccine, because that up to date vaccination, particularly getting that bivalent, that booster shot, is protective against getting COVID-19 and therefore dying from COVID-19 and getting long COVID.
Yeah, but the vaccination works, and there's 13 billion doses that prove that, plus a whole mound of evidence. All right, Dr. Norman, there will be a next time. We hope not very soon. What have you learned that's going to help us the next time?
Well, I think one is that we can't depend on experts and scientists and scientific research alone to carry the day on this. I think we really have to look at communities, because people really trust their community members or family members, and I think we need to think of a different way to communicate other than just experts, researchers, and scientists, because there's a little bit of crisis of confidence, I think, with that. Second, and we haven't talked about outcomes and equitability, we've learned so much during this pandemic that there are people that, because of ethnic, racial, socioeconomic, travel difficulties, rural, urban, that do not have good access to care. And now is a time we should be looking and saying, how can we find everybody to bring them into the system? So in our case with COVID, it was finding them to test and to treat and to care for those folks that just can't find their way into care. I think those are a couple of critical things. I think continued messaging about vaccine is critical. You mentioned how many billion. I gave 4.3 million doses of the vaccine on my medical license, and I care a lot about the moral burden of that, to know how that vaccine is being received by people. And it's a wonder drug, and I'm comfortable with it. But we have to keep doing that. One last comment. And it's going on right now in Topeka with these anti-vaccine hearings that are happening. I have provided testimony to those in the past. I had just come back from a combat region in the Middle East, and I felt more unsafe in that legislative hearing than I felt during my combat and Middle East experience. We have to dial back the anger and the threatening nature of this conversation about vaccines. We really have to get around that.
Yeah, I think that rational conversation is something we desperately need across the political spectrum on both sides of the aisle.
And Steve, if I may, I think one of the things we can unite around is why do people get vaccinated and why do people not get vaccinated? And both of those factions have fear. The anti-vaccine people are afraid that the vaccine is going to be a problem for them. People that choose vaccine are afraid that they'll catch the illness. And I think it's really important to discuss around why our decision making is like it is, what fears do we have, and then to get beyond it into a peaceful resolution.
Just a quick comment about equitability, and actually maybe particularly importantly for continued vaccine promotion and use. Maternal health really took a hit with COVID-19, and that's not something that we necessarily hear. But COVID-19 had a direct impact on worsening maternal health outcomes in the last few years. We've talked about how much it impacted deaths overall in this country, but it also, more women died as a result of being pregnant in some form or another in the last few years and in the years prior, and that is because of COVID-19. And it's a really good example of something we can maybe rally around, because that, getting up to date on that vaccine for a pregnant woman or a pregnant person is really important and has a really immediate yield and can help us get back to where we were before, which, by the way, we had room for improvement before too, so we're even worse now.
Yeah, these are, the thing that I find that touches, I'm still concerned that we can't have an honest conversation without the anger, and it's not about, it's really not really, I don't think they're fighting about the science. I think science just gets caught in a political battle. And because there's a political battle, people are going to get mad about the science. But they're not because they're mad at science, it's because they're angry about politics. And that just spills into everything. So we have to figure out that political part. Hawkeye, yeah. What would you different? You should be in this conversation. So we're going to get to the numbers in just a second. I know there's the music. We want to get to the numbers, but I want you to reflect on this whole pandemic. What would you have done differently?
Yeah, I've been thinking about that. There's a lot for sure. I think it's hard because we are looking back, and you certainly asked Dr. Norman that. When we have so much more information now, it's difficult. I would really I think the most important thing is really try to find a way to keep the kids in school. I think that was probably the biggest impact, but that is not in a vacuum by itself, we know, because when kids get ill, then parents have to stay home anyways, and they're missing work. And so there's no one isolated incident. None of these details are in a vacuum, and it's so vitally important. I think maybe just to what Dr. Norman said is the way we message, and I think that was probably very important. Understanding that and understanding how confusing it was to medical and public health professionals, and then really trying to get out that clear message to the public, which was very difficult. But that was also in the face of trying to combat all the misinformation from day one as well. And so that goes back to Dr. Norman's point, his very first point that he said on the show as well. So I think there were just a lot of things working against us. We did try to do the best we could. I would would try to go back and see what is the best way to get the kids back in school sooner, in the safest way possible. But even doing that, you get kids back in school, we know they're going to be interacting with each other, spreading the virus amongst themselves. That was very clear. There was a recent New England Journal of Medicine masking study published, which showed that when kids went back, they did spread the disease. Now, masking helped reduce the spread of that disease, but then when they bring it home to caregivers and other people at risk, it is more important. I think people really forget what it was like, or if they didn't work in the health system, what things were like. And if you go back and look at videos, how much people were just in beds in hallways, and there were no ICU beds, there were no ventilators when people needed them. It was a very big thing, but I think people are really getting that amnesia very quickly and don't understand how significant and severe the crisis was when it was at its maximum.
250 patients in beds here with COVID-19.
Yep.
And that's out of, at that time, 750 beds. That's a full third of the entire hospital full of nothing but COVID.
Yeah.
And we were asking people to put the masks back on. And fortunately, Kansas City metropolitan area and the Core 4 rallied, and they did that. Had good leadership, and the community pulled together very well. And you know, we had a full crisis. A larger crisis was averted because of the actions of our community.
Yeah, and I think, Steve, to that point, you know, we still have people who are hinging on the words in those first couple weeks or months of 2 weeks to stop the curve. Okay, that was 2 weeks to mask, to not stop the pandemic. It was to help
Bend the curve.
Bend the curve. Get our systems and protocols in place so that when you're sick or your loved one's sick, we are able to treat you. And I think people are just hinging on that one sentence from 3 years ago and really have not moved on from that. And it's pretty unfortunate.
We know that April tends to be a great month, and I'm hoping we're zooming into that goodness. We're seeing the numbers drop as community transmission, although we know the data around community transmission is pretty weak right now. We have to rely on hospitalizations as the only real marker of where we are in the disease. I think there may be a bit of a heat map to pop up there if we've got that. Ooh. There we go. Pretty sparse. There's a few big red spots out there, but nothing bad like we used to have. Remember, back when things were really bad, it was all purple or all red. Did you guys get that other map in? I'm hearing it. There we go. All right, this is interesting. COVID patients in hospitals and ICUs, and we talked about these peaks. There it is. You can see the numbers rise back in the first wave, and then the first big wave, and the first winter, and then the next wave, and the next winter, and we kind of tailed off. You can see both hospitalization and ICUs are starting to tail off. We like the tail, but we're getting to one of the lower levels we've seen in a while. Not the lowest level, but we're starting to trend that direction. I think, Hawkeye, and partly that we now know there's a little bit of seasonality to the disease. But also, I think as people go back outside, the numbers drop lower, and then the number of people who have already had the infection, and of course, the number have been vaccinated.
Yeah, I think that's right. All of that, really. I think we may start to see some sort of seasonality. You know, initially, those first 2 years, I think it was just community spread no matter what season it was. I think we are starting to look into getting some seasonality, although I think there'll still be higher community spread of the virus compared to, say, like influenza or some of the other specific respiratory viruses, but we are getting there. It is getting better. And then, of course, immunity. I think, you know, community immunity and individual immunity is playing the largest part here. Number one, it's vaccines. We know that the vaccines provide that safer immunity to help reduce your risk of hospitalization and severe disease, but also long COVID, just as we heard Dr. Satterwhite say. So that's extremely important moving forward as well. But then also we know that if you have that hybrid immunity, which is basically vaccine plus infection, you are also well protected from those severe outcomes in those other issues as well, as far as long COVID goes. So I think all of that is playing a part, and we are moving through this as a society.
All right, Florida's Surgeon General wrote to the CDC and the Food and Drug Administration. Despite 13 billion doses across the world, he was concerned about the adverse effects from COVID-19 vaccination. He claimed there's been an increase in reports to the CDC's database, the Vaccine Adverse Event Reporting System, VAERS. They, of course, wrote back to him saying his claims are incorrect, misleading, could be harmful to the American public, personal opinion, grounded in politics, not reality. But Hawkeye and Dr. Norman, Dr. Satterwhite, feel free to weigh in. This brings us at this point that we've talked about before. VAERS is largely very subjective in its nature. It's hard to necessarily depend upon the information, especially by now when the science is so strong.
So VAERS is a really important part of our vaccine monitoring system, but it is like you mentioned, it is very subjective, and anyone can put a report into the VAERS database. What we do have is we have CDC scientists who look at what's put in there to see if there's something that does need to be investigated. So it's so it is not meaningful from a number of reports into VAERS. And it is still important to have that option for people to report anything they're concerned about, knowing that someone will look at it.
And Dr. Norman, there's been some accusation that people are trying to undermine it by just putting in all sorts of stuff.
I have heard that, and it wouldn't surprise me. It's kind of along with social media that there's so much that's so easy to denigrate and to smear, and that's yet one more place where that can be done. I still have faith in it. Dr. Satterwhite talked about what the CDC does in terms of looking at it for signals when there's some kind of a cohesive signal coming out to be investigated. And
those signals you look for in multiple areas of the country, multiple signals, lots of information around it to corroborate it, and then you go take the science and explore it.
Right, and most of it's noise, quite honestly.
Yeah, I mean, if you remember, one of the best recorded or written about examples is there was a person who had put in that they were turning green and growing, and they thought they were turning into the Hulk after getting the vaccine. So it's just absurd things like that that go in there as well. And I think it is somewhat concerning that a person that has gone through medical training and science training is doing this, saying this. It is very concerning for sure. It is not following the science and being up to date with the actual data and science. And I don't know what else to say. It is concerning for the citizens of that area and that community. But a lot of this does seem to be politically charged.
As we said before, don't be a rumor reporter. Bring back some old terms. That's pretty good. All right, guys, let's turn to Jessica and see what questions our viewers may have today. Jess.
Hi, Dr. Stites. Good morning. Gene has a question. He says, I believe there is legislation in the Kansas legislature to curtail childhood vaccine requirements. What should we do about that?
Protest against it.
Yeah, absolutely.
Catherine, Lee.
Well, and also to take away the KDHE secretary's ability to propagate after public hearings and whatnot, to propagate regulations for school vaccines. And I think that would be a step backwards that where we were 100 years ago or the Dark Ages. And I think that should be derailed.
Yeah, I would absolutely agree with Dr. Norman. I think what you need to do is go back and pull those charts, pull that data of the number of children and or even adults that acquired those infections, were hospitalized, had severe outcomes, even death, and you will see that the vaccines protected people against that morbidity and mortality. Just a recent news update, there was that recent measles outbreak in Ohio, in which I believe they had 85 cases. Of those, 80 of those kids were not vaccinated or they were partially vaccinated. And you say, okay, well, that's just measles. Well, when you understand that 35 of those kids were hospitalized, you understand that a large proportion can be hospitalized and have severe disease. So I think rolling back these childhood vaccine mandates would be extremely dangerous for that child, but also for that family. What if there are immunosuppressed or at-risk caregivers or family members as well who can come into contact with some of these organisms? So I think it is just it's a
bad idea.
Something from the Dark Ages, just like Dr. Norman said, for sure.
To Dr. Hawkinson's earlier point, it's important to keep kids in school, and we do that by keeping them healthy, and that keeps them healthy, their classmates healthy, their teachers healthy, all the school staff. Childhood vaccines in general are one of the primary public health successes over centuries.
Yes, absolutely. Well said.
Jess.
So Katie wants to know, looking forward,
bad idea. Go ahead.
When will we start another round of vaccines? Katie would like to know.
Okay, Hawkeye, what do you think?
Yeah, I mean, again, I think we are looking at, and what we have heard from the CDC is recommendations maybe yearly for the COVID vaccines, maybe coupled with influenza. As of right now, there is not a single influenza COVID-19 vaccine, but they are looking to couple them around the same time period. I think we just have to see moving forward what will the recommendations be, and that will be based off the data. I know that right now the influenza group that makes the recommendations for the vaccine in the fall, they are meeting right now to determine the best formulation of the vaccine for influenza. But I think most of us are expecting for a recommendation to come down as once yearly. Certainly as we get more data for those more at-risk immunosuppressed patients, we may see something different, but right now it looks like once a year.
I'd like to also build on this, just since we're talking about vaccines. You mentioned sort of that we know mRNA vaccine technology has been being researched for decades, right? One of the really positive things that we are able to build on as a result of our experience with mRNA vaccines actively during the pandemic is understanding the real important utility, flexibility of this platform. So I think it's going to be really exciting to see what other public health advances we're able to make because we now have mRNA vaccines tested in the field.
Well, and I think that the idea that we're messing with the immune system, we shouldn't do that, right? Okay, so let's just think about it. Chemotherapy.
Couple more questions.
Is so bad relative to compared to all the side effects with cancer. And you look at the new biologics, which manipulate your immune system, how much more successful current cancer therapy that is today than it was 10 years ago. It is a modern miracle of science that has led us to that. Yet there's not all this revulsion to the idea that we should be using biologics, which manipulate your immune system far more than a vaccination does, and yet saves lives in cancer. It's this politicalization of the conversation that's led us away from the facts into this never, never world, I think. Okay, there's my strong statement for the day, Jill. So I'm back to you for questions. So I'll get myself in.
Okay, so Sharon, her and her husband, they still wear their N95 masks. They avoid gatherings. They still don't go to restaurants. And they recently, though, had to take a trip on an airplane, wore their mask, but the guy next to him was coughing, and they're convinced that that's where they then, a few days later, both came down with COVID. They're just curious, is there really any way to stay protected on flights anymore, especially if traveling to see vulnerable family members?
Dr. Norman?
I think that the things that we've been doing with masks, hand washing, cleaning the environment around us, and distance oneself if they can. I realize if a flight is full and you're in midair, it's a little hard to distance yourself too much. But I would stick with those things and just be very religious about adhering to them. I think it's the best they can do.
I don't think there is anything better. We know they've already redesigned commercial aircraft airflow in order to make it safer. I do think it is better than it once was, but if somebody does have COVID and they're sitting next to you for 2 hours on a flight, you probably have you may have an N95. It's probably not completely fit tested, so it's not going to be perfect. You can easily get COVID in that situation. And once you have COVID, your partner gets COVID. So unfortunately, that can still happen. I don't think you can completely avoid it, and I don't think we're going to stop airline travel in order to do it. This is a balance in our lives. We've talked a lot about the balance here. And, at some levels, you have to think about, when can I get back out in public? When can I do things? I know there's still going to be some risk. Let me protect myself the best I can, knowing my own personal health situation and my own level of comfort, and that becomes a personal choice. And I think that's a calculation each individual has to make.
And not to be a broken record, but staying up to date on vaccines.
It helps a lot.
Helps a lot. And getting tested if you feel like you might have some symptoms suggestive of COVID-19, because we do have good therapeutics.
Yeah.
Jess.
Last question, Dr. Stites. So Yen Liang wants to know, now with everyone unmasked, the question is, when everyone's unmasked and the protection of the previously vaccinated folks wears off, will it allow then COVID-19 to come back again in some form?
Okay. The surge, the rise and the fall of it, I don't think there's any way to prevent that.
Yeah. And I think we have to be careful about what is meant by the vaccine wears off. We know that you're going to still have good durable immunity. Your antibody titers may be less, but you're still going to have a very good T-cell response should you come into contact with the virus. I think when you are going to have, maybe as we get into the seasonality of it, if people are doing more things indoors and they are meeting, you probably will have surges in the overall circulation of the virus. But as we have had people who have been vaccinated and infected or multiply infected, they are developing that immune response to have hopefully less chance of having that hospitalization or severe disease. And are we getting to the point, and I don't know when this will be, but when this coronavirus is going to become more like one of those other 4 seasonal coronaviruses that just cause a common cough or cold. And so I don't think we're there yet, but we feel that is maybe the way we are moving to.
All right. Well, this has been an outstanding program today. It's been a trip down memory lane. I'm thinking about some of those old Beatles songs. You know what I'm saying? If we could just get a little bit, I Want to Hold Your Hand or something like that going, we'd all feel like we were doing another trip down memory lane, too. Let's get some final thoughts. Dr. Satterwhite, I want to first of all, thank you for being back on the program again. Always a pleasure. And final thoughts.
Final thoughts. So one thing we didn't talk a lot about was where we are now in terms of health, public health. So one of the things that I'm really focused on and thinking about is how we can reinvigorate the public health programs that actually suffered a lot during COVID-19. I'm talking about physical activity, nutrition, mental health, substance use. So I'm really excited to get back into that space and try to increase people's overall health and continue to promote the things that we know from a public health perspective, like vaccination.
Yeah, I think that's really important, and yeah, public health, mental health, they go together. Dr. Norman.
2 thoughts, and they're brief. One is thanks to you guys. Thank you guys, for being providing the great information. You're one of the great news outlets during this 3 years. And if I tried, and the governor and I tried to give press conferences and the like, you guys did it and amplified it even greater. And I think you should have a daytime Emmy for the work you've done. Secondly, we talk about this virus going away. Let's beat it into submission. We still have tools. We still have the vaccines, and you can still wear masks, and you can still avoid other people and groups. And I back out of situations where I think it's kind of risky for COVID-19. I've not had an infection with it yet, and I'm vaccinated, and I feel like that we can beat this into submission. So don't lose hope.
And you've traveled all over the world in the meantime.
Yes.
Doc Ock, final thoughts.
Just thank you to our guests. So good and fun listening to these. The answers and everything that they've had to say, hopefully continuing to educate our community, because it is still out there along with other things that we heard about. So I think it really kind of boils down to you as an individual doing the best that you can do to protect yourself and your loved ones, eating well, getting good sleep, getting activity, and staying up to date with your vaccines.
You know, I've had the distinct pleasure of being able to know each of the folks on this program today for approximately a very long time. And what I know is not only are they very bright people, they're just good people. And I think you can listen to the words of good, bright people and know that when you take that and you learn a little bit about having faith in people, you combine it with the hope of trying to make sure we can get through this together and the understanding what that means about what you do know and what you don't know, and you apply science, we can get through just about anything. Faith, hope, and science with good people. Can't beat it. I want to end with something else kind of exciting, maybe even very exciting. The Kansas Museum of History is renovating its galleries. They've asked if there's any way possible to get one of Dr. Lee Norman's white coats, his white medical coat, from his time here as chief medical officer. We searched our way back to the back part of the closet, although the man did wear them every single day he was here. Guess what? Jill Chadwick was here to show us what we found. Jill?
Hey, I got to hug this guy. I haven't seen him in a while.
I know. Thank you.
So Anna Woods, who is the museum curator, she did call and ask us if we could find a medical coat, and by golly, we did. Now, I will say that she said, could I have a coat or a mask? And we opted for the coat.
Thank goodness. I wouldn't want one of his masks either. God knows what kind of germs are in there.
Yeah.
Oh!
It could be a bonus.
It's brand new.
So you say. It's all wrinkled.
And I don't want to say that you're a relic, but
just say it.
I do want to say that I think what Anna and the museum is trying to document, Dr. Norman, is just everything that you have done for the state of Kansas, including when you were here sitting in the chair that this fine man now has to sit in every day. So we
big chair
miss
to
you.
fill.
We love you. We're all too happy to give this to the museum with your blessing.
I wondered where that went. No, happy to ship it over to the museum. I'm very honored, and I don't feel like a relic yet. And thank you guys. I appreciate that a lot. Thank you all.
You're not.
All right.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now everywhere podcasts are available.